What we're going to do is I'm going to ask each patient family to share, their diagnostic journey, anything they want to share about, their journey to n-Lorem and what it's been like. And so, Cara, I'd like to start with you and talk about Nolan, who's actually here, if anybody wants to see him later.
He's in the back there with his dad and brother. Hello, my name is Cara, better known as Nolan's mom, or a self-proclaimed Nolanologist. Nolan was born February 3rd, 2018, and soon after he started seizing. Our local hospital wasn't equipped, and they said, "Mom, you need to go somewhere." And I said, "Okay, take me to CHOP. We live in the Jersey Shore." CHOP was full. So I said to the attending, "Where can I go?" And she looked at me, she's like, "Ethically, I cannot endorse it." And I said, "Are you kidding me? I'm not writing to the paper. Like, my kid is seizing." And she goes, "I think he needs a children's level 4 NICU. The closest next to CHOP is DuPont." So that's where we went, Children's Hospital in Nemours, DuPont. And if you see the picture there with him, with all the intubated and all the lines, his seizures were pretty bad. They had to actually induce a coma. They couldn't stop seizing. And I can remember before every single increase on a drip, you have to say, "Okay." And one time, they did it too much, and I stared at a flat line on an EEG. I can't remember how long it took. They reactivated his brain, obviously. And then very soon after, we received our diagnoses, just 17 days after life, February 20th, KCNQ2, developmental epileptic encephalopathy. We immediately started sodium channel blockers and a ketogenic diet. While we were in the NICU, Nolan received the G-tube. I remember being terrified, and now I've changed it in the parking lot. He had to have double hip surgery, bilateral, dislocation and dysphagia in his hips. And we went home. I never left him. I went to the hospital, I had my baby, and I was leaving with him. May 10th, we went home, and soon after, things actually went dramatically downhill. If you see the picture of Thomas in the red jammies kissing his brother, and then the other one with me in the hospital with him, you notice Nolan is pretty pale in color. In July 2018, we went in for a routine EEG, and they did some blood work. His hemoglobin was a 2.3 hemoglobin. And I remember the resident was like, "Mom, we're gonna redo the blood work because this can't be right." And the attending came running in and hit a button on the wall, and I'd never seen that before in my life, and lights went off, and a team in black scrubs came running. And they immediately took him to the PICU, and from there, it was a very traumatic journey, trying to figure out why he was having this bleed. We did every test we could think of. The only thing we realized there was blood coming from GI because his stool was positive. For blood, we did endoscopes, colonoscopies, echo scans, and everything. And finally, we actually landed in the PICU with scurvy, rickets, failure to thrive, 2 broken legs. We've had, at this point, weekly blood transfusions in the hematology oncology floor at CHOP. We had 2 PICC lines I maintained at home, and here we're at the PICU, and they said, "Okay, let's take you off the ketogenic diet," last thing. And lo and behold, within 2 months, everything related to his protein-losing enteropathy and anemia resolved. It was a very rare reaction to the ketogenic diet. Unfortunately, soon after, in May, he went into status. So they said, "Okay, Mom, you can induce a coma or try ACTH." I said, "No," did the coma thing, not again. We did 2 rounds of ACTH because it actually did make an impact on the EEG, but it didn't stick. And I'm telling you this because the doctor, remember, he said, preparing us, you may see some swelling and then ACTH face. And I remember the whole time thinking, thank God that did not happen to my baby. And I don't know if you see Hawaiian Nolan, but love is blind, because I look back and I was like, oh my God. Like, no, ACTH did beef us up a bit. And unfortunately, it didn't stick after the second round, and you can't live on ACTH. So we moved on. And eventually we had to stop chasing his EEG. Eventually, long story short, finally we got some stability with rotogabine. We went from daily seizures to weekly seizures. He's more present and given my husband and I and his brother a quality of life that we didn't even think possible. However, we still want more. Nolan has cortical visual impairment, so he's blind. He's fed through a G-tube. He's non-ambulatory. He's 100% dependent on caregivers. He's nonverbal. So I started trying to figure out how to really help my son. And I reached out to anyone and everyone I could find with KCNQ2 experience and in the ASO or CRISPR sphere. And eventually, in October 2020, I'm going a little back and forth here, just told a story, but this whole time I was pursuing and reaching out and trying to get help. n-Lorem accepted Nolan in October of 2020, and it's been a long journey, but they never gave up. And here we are, because Nolan is more than his diagnoses. If you go to the next slide, you'll see Nolan is cheeky, and he loves the beach, and he loves the wind on his face, and he loves the park, and he loves, more than anything in this world, he loves his brother. And no one really prepared you for that as a parent, seeing what it does with your whole family. And here's Nolan living his best life on the beach there. He loves it. And so Nolan's more than KCNQ2, and it's very isolating, as many in this room know, when you have a nano-rare disease, but n-Lorem never gave up. Like they just kept going, and then finally we have some good news. And I just wanted to, my friend asked me, what does n-Lorem mean to you? And I was having such a hard time, because if you don't have a significantly sick child or a loved one, it's very difficult to explain it. So I said to her, I want you to close your eyes, and I want you to picture your baby, the person you love most in the world. I want you to smell them, I want you to hear them, I want you to feel them. I want you to see them. And I want you to picture their absence, they're gone, and there's nothing you can do. They're gone, and this is what we've been told as his parents is going to be our life, right? I said, that's heavy, right? Like super heavy, like knowing that like this is your future, this is it, this is coming. No matter what you do, this is coming. And it's such a heavy weight that you can't breathe at times. And n-Lorem came over and said, we can't take that weight from you, but we can help you carry it. Give us some of that. Take some off your shoulders. And so they took some off of my shoulders, and then with every little email, every little positive move forward, the n-Lorem said, give me some more of that weight, give me some more of that weight. And then finally one day, you open your email and you find, and we started the GLP tox stage. And you find yourself no longer thinking about the deafening silence of your baby's death, but you find yourself daydreaming about what his brother will do if he reaches out for him, or what his dad would do if he looked him in the eyes, or what one day his sweet little voice will sound like saying, Mama. And that's n-Lorem. n-Lorem is more than hope. n-Lorem is life itself. And I don't know how you put that into words, so thank you, Amy. That was it.
I didn't even make it through one story. Jonas?
Oh, wow. It's an incredible privilege to be here. The parents here are real inspirations, and the scientists and advocates, I mean, I can't put into words, just how much gratitude I have. That's Bowie. I waited a long time for a child, and she came to us during a crisis, during COVID, and it was particularly hard for me. I lost my dad 2 weeks after she was born. My mom suffered just terrible loss of health right after and never recovered. So it was very isolating too, you know, being in New York City, everything shut down. And we were new parents, but we had this beautiful kid who was so happy, and we were just in this little enchanted place trying to just focus on her. And months in, she had no head control, she hadn't hit any milestones. We worked with early intervention in the city, which is really a great program. They had people coming over a lot, Bowie roll over, Bowie roll over. You know, nothing worked. We noticed her eyes were misaligned, and this is something that, that Sarah had mentioned, nystagmus, was identified by the ophthalmologist that we went to. He said, you have to get an MRI. So we went to a neurologist who said we don't need an MRI, and the ophthalmologist convinced her to get an MRI, and then couldn't really read any issues into it, said it was uneventful, no issue. We went back to therapy. We went back to neurologists. We found a muscular neurologist at LIJ who suggested we go to a geneticist. And she took some studies and waited, more therapy. Ida got rid of my guitars and amps and put in a cage, turned our home into a little PT clinic. And we got a call back, and they told us that she had Tub 4A leukodystrophy, which is a progressive disorder, and we really shouldn't expect, you know, much, but we, you know, should continue with PT. My wife was crying. I really didn't know what to make of it. You know, she's a lot smarter than me. She's the science side of our brain, but I could tell that there was something really terrible. You know, at that point, we just really lost, you know, a lot of hope. Finally, the geneticist called us back and said, you know, I know somebody at Columbia, Wendy Chung, n-Lorem, you should look into this. And you know, that sparked some hope. I didn't know what to do. I mean, I called, we were going to CHOP at that point. The doctor that had discovered Tub 4A was at CHOP. There was no treatment there. So we contacted Wendy. She was moving to Boston. Anyway, she helped set us on this path. And you know, it's been a couple of years, you know, to get to this point. It's been a lot of intensive therapies. Bowie still hasn't hit any milestones, but she's just the light of my life. She's so happy. She's just so much fun. There's Ida walking with her. She can take steps if you hold her, and she's very joyful as she does it. It's quite amazing that, you know, what that does for me. But we're really at a point now where we're about to get treatment, and I don't even know how to process this. You know, it's just a remarkable thing. But to come from a place where you have no hope, it's such an impossible thing to live with. And you know, Amy and Wendy and Joanne and Kendall and Dr. Kravis and all of these doctors who have really made this possible. I'm just incredibly appreciative. You just don't know how much that means to us. You know, this is a progressive disorder, and It doesn't end well, no matter where you are on this spectrum. That's Tub 4A. It doesn't end well. So to know that, you know, we have an opportunity to save our child, who's just the center of our universe, is just the greatest gift that I could ask for. So again, it's a privilege to be here. I'm so happy. I'm scared, but I'm really happy. And thank you.
Chao?
First of all, I want to thank Dr. Stan, Amy, and all the n-Lorem team for bringing us all here together, and of course, the Biogen and the other sponsors. I mean, this could not happen without those guys. So my name is Chao. Connor, our family is from Memphis, Tennessee. Connor was our first child, and as a first-time parent, you know, we just as happy as he can be. You know, he smiles, and when you play Cocomelon on or whatever noise, he'll start bouncing. And then, you know, before he had his 4-month shot, we always saw that he was looking towards the left. We were like, okay, maybe he's just a baby. He'll grow out of it, right? And then until he had his 4-month shot, the next day on a Saturday morning, he generally sleeps next to me on my shoulder. He started shaking and seizing really bad. I said, honey, I don't think this looks normal. It's just vibrating. Like, what do I do? And Catherine, who's sitting right here, her mom's a nurse, like, y'all need to just go to the emergency room. That was the longest 20-minute ride in my life. So we rushed into Methodist emergency room. They ran all kinds of tests. They couldn't find anything. A week later, the neurologist called and said, hey, why don't y'all come in and spend a night, and so we can do some EEG tests on him. And you can go to the next slide. So Catherine spent the night with Connor at the hospital. Around 6 p.m. that night, you know, when the wife calls, you pick up, right? So I was out with some clients, and she said a geneticist wants to talk with us. I'm in finance. I don't even know what the heck geneticists did. So your son has RHO-BTB2. I'm like, okay, what is that? So I started Googling while she was explaining and gave us a pamphlet. So when I was Googling, it's such an ultra-rare syndrome that probably less than 10 or 15 kids had it at that time. I still didn't know how to process it when she was trying to explain to me, but as I was reading what the other kids' future is, some of them can't walk, some of them can't talk, you know, using G-tube to feed them. So it didn't really hit me until that night. I don't think I slept the next week. I probably sent out over 100 emails to anything I can Google that has anything to do with RHO-BTB2. In China, in Australia, Europe, wherever. I was like, come on, God, please give me somebody reply back to us. So finally, Vanderbilt, there was a neurologist in Vanderbilt replied back. A week later, we drove up to Vanderbilt to meet with Dr. S, and he said, well, we're interested in your case, and I'm thinking about CRISPR. I said, okay, what do we need to do next? And he said CRISPR is a new technology, but we don't know if we can get it done on time to help Connor. It could be a 5-year, 10-year, 15, 20-year process, but you know, whoever else has this same syndrome may benefit from down the road. And as a father, I'm like, okay, let's go ahead and do it. Sign all the paperwork at his office. He, did the stem cell. So after on the drive home from Nashville, I felt so lost, but I never lost hope in finding a solution for Connor. So I continued to email some more people, and with us living in Memphis, I said, okay, St. Jude is an amazing place, and they're in our backyard. We literally live 10 minutes away from St. Jude. And I've been in Memphis since 1992, but all I hear is St. Jude working on cancer cases for kids, not really Connor's problem. So I emailed Richard Shadiak and some of the neurologists there, can you please look into this for us? And finally, Dr. Medford from St. Jude, she said, well, I think you have a much better shot at ASO. I said, look, I'll do whatever you guys recommend, to give him a opportunity to have a normal, some type of normal life. So that's when Dr. Medford said there's a company called n-Lorem that we will reach out to and try to see if they're willing to accept your case. So, being the person I am, very proactive, so I emailed Amy. I said, Amy, can you get us a meeting with Dr. Stan? So we did a Zoom call with Dr. Stan, and he's a much smarter guy than I am, number one, okay? So he just threw out the number 1.2 million, patient, cost per patient. So I said, before we end this call, Dr. Stan, if I don't ask you this, I'm going to regret it. Let's say if I sold my house and I can come up with the 1.2 million, can you help expedite this? He said, well, Chao, I know you're in finance, this is not how it works, exactly how it works. So right now we got accepted by n-Lorem March last year. Amy's been awesome. Anytime I had a question, she'll always reply back. I bet she probably get thousands of emails from patients' families like ours. So I'm very grateful for that. And St. Jude is working on it, working with n-Lorem. And Connor right now, as you see, he's happy as he can be. He has a younger sister, Kaya, who is a year younger. And she would ask, like, Daddy, Connor's not talking yet. I said, that's why you got to talk to him more and teach him, the way. So some days, we feel like Connor gets all the attention. And with Kaya, we're so grateful that she understands, sort of like, hey, Connor needs to be fed. Someone has to watch Connor 24/7. I can't tell you how many nights I slept with Connor. Many nights crying myself to sleep, and my wife is a lot stronger than I am, trying to figure out, praying, hey, there's always light through the tunnel. And I'm a firm believer of God will never put us in a position that we cannot handle. And thank God we found n-Lorem in St. Jude. So as the last 2 days, everybody heard there's no magic pill. We just got to be patient and let itself work out. So as a parent, right now he's getting ABA 6 days a week, PT, OT, speech, horse riding therapy. So whatever you can do to help your kid, don't give up. Some days are harder than other days. Just remember, we are in here for a purpose.
Madeleine?
Hi, my name is Madeleine, and my daughter is Margot. She was here yesterday hanging out. She was born typical, and at 3 months old started having seizures that brought us to Boston Children's. We live locally here in Boston, and had her first EEG and was diagnosed with epilepsy. For us, the children's team sent out for genetic testing right away, which in hindsight was so great that we were able to get a diagnosis within about a month and a half of her first seizures, and this was in summer 2021. And Margot has several mutations in the SCN8A gene, which regulates electrical activity in the brain. And so we knew pretty early on what the diagnosis was. But what was more challenging was figuring out exactly what that meant for her, because like many disorders, there's such a spectrum in terms of the outcomes for patients with these mutations, and we just didn't know. We saw in the community there were some patients that were more mildly affected, that could walk, that had some ataxia or autism, and then there were some that were really severe, a lot of children dying young. Was really bad refractory epilepsy and many other things. And because no one had her combinations of mutations, and because initially her seizures were pretty well controlled with Keppra from that first visit, we just didn't really know where she would fall. And we tried, I think for the whole first year, to convince ourselves that she would be on the mild side. But quickly she developed a lot of different seizures, and Margot would have up to 200 seizures a day. She's had over 25,000 seizures in her 4 years of life. I'm a scientist, so I track them all one by one. And We've tried 11 seizure medications, the keto diet. She still has seizures every week. These seizure meds come with so many different side effects, and we've had to stop many because of the side effects. And so it's just been really hard to control that. But I thought initially, you know, if we could control the seizures, then the rest would be okay. I mean, we've never been able to control them, so had to give up on that. But I think the hardest has been all the other stuff that is impacted when your brain is not functioning at such a severe level. You know, Margot has really low muscle tone. She's never been able to control her head or anything, grab things. She has CVI, is, you know, legally blind, cannot make eye contact. She makes sounds, but that's it. And she has really, really weak lungs, so we've had many different hospital admissions for respiratory issues. She's on a ventilator now, and her lungs just keep getting weaker and weaker and weaker. And, you know, we're kind of running out of options. Her GI system is also really messed up. It's still something that's not really well understood. You know, she's not able to take any food by G-tube. We have to feed her with a J-tube by continuous feeds on a pump, so she's connected to machines all day long. It's the only way her stomach can, or her body can take food. But she still vomits every day, multiple times a day. And so having, you know, kind of seeing like what else happens to the body when the brain, you know, is so, has, you know, so many issues. That's just really frustrating, and while her disease is not degenerative, because her body is so weak, you know, it's just her other organs just really, really struggle. So, and we're at a point where adding new medications affects the other medications and causes so many issues, and we've tried adding things and that doesn't go well, and so it's just really hard to manage clinically, and you know, it's just really hard to see your child decline like this and struggle and be in pain. My husband and I are both scientists, so we learned about n-Lorem very quickly after her diagnosis, and that was really exciting and gave us a lot of hope. And Margot was accepted in the spring, summer 2022, and you know, that was really, really exciting. You know, having that hope has been everything for us, and being able to kind of fuel our efforts into kind of trying to support that has helped us, you know, give us something to do to try and help her, because nothing we can do can really help her at home to get better or to help control her seizures. I think, you know, our biggest fear is that, you know, she will not make it to the ASO because she's just getting so weak and her body's struggling so much, and it's hard to watch your child suffer like that. So we're really hopeful, and we hope that we can get there.
Lisa and Colby, you're going to talk about Colby, who's also here today. I heard her this morning.
Everybody has probably heard Colby at some point throughout this conference. If you didn't meet her in the hallway, you might have heard the happy squeals or the stubborn squeals from the room next door. Colby is 6.5. She's part of a blended family, so she has 4 teenage siblings, which I think have helped her in a lot of ways, just having multiple family members to support her and to cheer her on throughout her journey. This is her. I just wanted to share a few pictures of who she is before talking about her journey, because for me it's been a lot easier just to always focus on who she is most of all. It's hard to stop and really process what her disorder means and what, you know, may or may not happen to her because of it. When Colby was born, she was a beautiful, perfect baby, and you know, I wasn't a first-time mom, and I knew what things to look for, and there wasn't really any signs of anything wrong for the first few months. There was torticollis, or her fontanelle closed early, but we actually went to a PT, and we were told that we could go home and didn't need to see her again, and went to a neurosurgeon who said, "This is a beautiful, perfect baby, you know, go home and don't come back." And you know, people really didn't see it coming. Around 6 months we started noticing something similar where she wouldn't look to one direction as much, and we started noticing that she wasn't crawling or sitting up as fast as my older kids had, but they crawled early, so I was trying to not be that paranoid mom that was expecting her to do things sooner than she would be able to. Around 8 months, we had noticed some eye movements that seemed a little strange, but we also noticed when we picked her up at her little part-time daycare that all the other kids would come running up to the door, or even if they couldn't walk yet, they'd see us, and Colby didn't know we were at the door until we were like in her face. So she wasn't crawling and she wasn't sitting up, and we thought, maybe this is just a vision thing, nothing big. She's smiley, she's reactive, and all the other things seem to be okay. But we went to the eye doctor and mentioned the eye movements, and she said she is farsighted, but I would maybe go see a neurologist to check out what's going on with her eyes. So we did go to a neurologist, and next slide is when the real stuff started for us, and where kind of life as we know it for Colby is frequent EEGs and doctor's appointments. But we were very fortunate to have a neurologist at that time that he noted hypotonia, and we heard in a lot of different places and from a lot of people, she'll outgrow that, give her time, and if she doesn't, then you'll know later if this is something you really need to worry about. But he said, let's go ahead and do an MRI, and let's do some EEGs, let's get her in PT. And those tests didn't show anything at that time. So we were still just like, what is going on? Like, why? At this point, she was closer to a year, and she still wasn't sitting up very well and wasn't crawling. But everything else still seemed okay. So she ended up going through some genetic tests, and we did the microarray and a few others, and everything was coming back normal. And I joined a Facebook group for hypotonia, and I've realized since then that we get so much information from parents, and being on social media, that can be really helpful, because somebody said, do the West test, the whole exome sequencing, and I went to our doctor and said, can we just jump to this one? And they had put it as like, if you're in a library and you do the microarray, this may not be accurate to the way you guys see it, but the way it was explained to me was, if you walk into this library, you see all the books on the microarray, but if you get the whole exome sequencing, you're reading the books in the library. So it was a digging deeper, and I'm not the most patient mom, so I wanted to dig deeper and wanted answers. Meanwhile, we went home and watched YouTube videos on all sorts of different disorders, trying to guess what it could be. All the hopeful, maybe it's just that kind of feelings, maybe it can't be that. And our doctor did compare it to Rett syndrome, which we learned about, and that sounded scary too. But then he said he thought maybe it was Rett syndrome, but he couldn't say that clinically because something seemed different with Colby's movements, and something just didn't seem to fit that puzzle. So we did the whole exome sequencing, and we got her diagnosis when she was 17 and a half months. I remember they called when she was in OTPT, and they just said, I want to let you know it is KIF1A, and we don't really know much about that. That Google says it is similar to Rett in some ways, but we need to send you to a geneticist, and you can talk to them and hopefully learn some more. So we went to the geneticist, and he said, I hate to say this, but you, at this point in time, probably know as much as I do about this disorder, because it's so rare, and at that time there was only 300 people in the world diagnosed with it. We were super fortunate that with only 300 people in the world, there was an organization that had been set up by Luke, KIF1A.org, because being in this world now, I realize not a lot of rare diseases have that, or a lot of parents have that resource to turn to right away. And there was Dr. Chung, who was already researching KIF1A, and it wasn't answers, it was still a whole lot of this might happen, she might walk, she might not, she might lose her ability to walk, she might lose her vision, she might have seizures, all the worst things you could possibly hear were all possible, but there was this place to turn to that other people could say us too, and we're with you. So thankfully, we did have that. I kind of turned into mama bear mode, and we just focused on trying to keep her as strong as possible. I think Gunner's mom maybe said it, where it's, you just want to, maybe if I can keep her strong or get her to this point, then KIF1A can't take as much away from her. And I know now that's not really how it works. I know the variants are just, they're going to affect the kids differently, and even within her variant, they impact the kids differently. But I do feel that the more we build her up and keep her strong for her own independence, that's helped her a lot. She's a very strong-willed kid, and we're starting to see now that, you know, we got to let her lead the way. She is loves her PTs and all of her therapy. She does speech, feeding, physical therapy, and horse therapy or hippotherapy. And as long as she's loving those things, that's the most we can do for her, is to keep her in these, to keep working on her skills. We were, obviously, being part of the org, we heard about the ASO and n-Lorem through Susanna and Sloan doing it. And Sloan and Colby actually have the same variant, so we were hopeful that Colby would be eligible for that same ASO, but then we learned that it isn't done that way. It's more about the SNP. And so we, you know, had the talk to decide if we wanted to, you know, pursue this and let Colby then be the first one to have this drug. And we decided to, you know, go talk to Dr. Chung, and she applied for us, and we received acceptance last July, 2024. So it's, like everybody said, it's not a cure. It's hope. It's just the only thing we know to do to really try to, you know, give her the best life we can. And we're just really thankful that we're even here. It's surreal to be here. I told Byron when we got here that it was just, you know, I hadn't stopped and thought about how, like, fortunate we are to be in this situation, and we just really appreciate everybody who's working on this for Colby and for all the kids with rare disorders, because there is a lot of places you go where they don't know anything about what we're dealing with, and to have a place that people care and want to help is huge.
So I know we spent a lot of time yesterday kind of going through the clinical data that we're seeing, and I know that's probably everyone on this panel has not, you know, undergone treatment. You're in various stages of, you know, the process. You know, and then we talked about the safety, because I think other than Tub4A, which has been in a patient, you know, you guys are all going to be, your child is going to be the first to be dosed with an ASO. And I really want to know from a patient family perspective, like, how did that feel yesterday? And you know, did that give you any sort of relief or take a burden off of you to see kind of the data that we shared with the community? Because it's got to be a terrifying prospect to be the first to take a medicine that's never been in a human being before, and then to have your medically fragile child be the one. It just, you know, we're always very sensitive to that, and that's one reason why we felt it was really important to share as much as we have over the last day and a half.
I think on our call I brought up that I was, you know, nervous, optimistically nervous. It's not something that I think it's not a decision that you want to ever have to make, because you don't, nobody says I want my kid to be the first to take that drug, but we also are, again, it's mixed feelings, because we're so happy to be able to have a choice, to have that option in the first place. It's scary, but it's hopeful. And what we know about KIF1A is that it is degenerative, it is progressive, and it's really hard for me at Colby's age, because I see her making progress and doing, you know, talking more and doing things more, but the reality of her disorder is that she is likely to lose those things too. And talking with, you know, other families who have older children who have been where we are, and talking to them and asking, like, what would you do? And if they could go back in time and start this treatment earlier, they gave me that answer. And that helped, and it was hard to say that, but I look at like, what can we do now to help her and stop possibly what could impact her.
Yesterday's not only was the safety data, but the other proven benefits that were unknown. Honestly, it's gotten me excited. And Nolan, I hope Nolan is the first. KCNQ2 is a brutal disease, and I hope he's the first to show proof of concept so that the community sees there's hope. Nolan is a hero, and I've never been so excited for my community as a whole. It is a nano-rare disease. His mutation is nano-rare, but AES put up a couple of years ago, if a baby is to start to seize in his or her first month of life, and it's a genetic cause, more likely than not by far, it is KCNQ2. These children they're like my Nolan, a lot of them, and there's a big spectrum, but their lives matter. And I truly hope that after we are able to give Nolan this ASO, the community can see that there's more to look forward to in the future. So honestly, yesterday and today has just made me excited.
Yeah, I agree, and I think seeing the good safety profiles for all of that also is just so comforting to hear that. And seeing, I think, what the other things that, the gains that have been, I was pretty impressed with the poop scale and the improvements, which GI is a major, major issue for us.
Hear that up here.
And I was like emailing her clinician, I'm like, we should add this because, I track this and she's on so many meds for GI stuff. Like if we could take all of those meds off and like not have to worry about that, like just in itself is like huge, for quality of life for her. And so, hearing kind of those other effects, obviously we hope seizures and we hope broad development, but those other things is really exciting to hear about and makes us think kind of even more hopeful of other things that can be accomplished.
Being in finance, I'm a numbers guy. Data doesn't lie. So it was very impressive and encouraging to see all those numbers, throughout this country. We all are different, but yet we all are the same to try to make our child's future better. I always lose sleep, what if both Catherine and I are not here? Who's going to take care of Connor? At least, he may be the first one. Yes, I'm sure there's some kind of risk, but I'd rather take risk than no hope in the future. So I applaud all the researchers and everyone at n-Lorem or any of the hospitals. They know what they're doing. As a parent, we got to give our children a shot at this because I don't want someone to have to feed Connor for the rest of his life or go use the restroom the rest of his life, or can't tell us how he's feeling. I think that's the biggest struggle every day when your kid is not nonverbal and you don't know what they're trying to express to you. So hopefully this is a start for RHO-BTB2.
Jonas, I don't want to decrease your probably level of anxiety for this medicine too, because I think, every parent, when they come to the decision, is going to have to make, that decision, like I'm going to treat my child with an experimental medicine, and I'm sure it's a difficult decision.
I mean, I really appreciate, I'm a math guy too, and I really appreciated the presentation yesterday. I actually feel very comfortable with the way in which, the foundation has approached safety. I really appreciated how you laid it out. I'm actually a lot more comfortable with that than just waiting on the results of the MRI that that I need to take before, or Bowie needs to take before we get there, just hoping that it looks good. But I feel really good about the way n-Lorem has approached things, and I'm very confident and comfortable with the safety measures in place.
I do want to a lot of you have been in the process for a long time, and I think people who are in the audience that are seeing the data, and now, you know, that we have patients who are on treatment longer, like we're getting more and more of this data, and, you know, it's all very positive, and there's gonna be people who think, well, I should get accepted, and then I'll have a drug in a year, and I'll be ready to go, and, you know, I know that most of you have been in the process here with us for, you know, since 2020 and 2023, and so, you know, no one up here on the stage has been treated yet. This is not an overnight thing, and I'm just thinking that it's probably very difficult as a patient family to stay the course with us, and I didn't know if there's anything that you would like to share with the patients who are in the program or who are thinking about it on that subject.
I would just say trust the process. They never quit, and they don't give up easy. So it might not be tomorrow, but they're going to do everything they can. And just, I don't even, you guys are just, I don't even have words. Like, patience, because whether you hear from them every day or not, they're working nonstop.
All right, can you give our panel